Hi, my name is Doris Germain. I'm a professor in Hematology Oncology in the Department of Medicine at Mount Sinai.
My name is George Miller. I am on the faculty of New York University School of Medicine, and my role at NYU is I'm a surgeon scientist.
My name is Cynthia Zahnow. I'm a Ph.D. basic scientist. I'm associate professor at the Sydney Kimmel Comprehensive Cancer Center at Johns Hopkins.
My name is Nabeel Bardeesy. I'm an associate professor at Mass General Hospital and Harvard Medical School.
So the Samuel Waxman Foundation has been critical for my funding since I've been to Mount Sinai, since 2002. So Sam was actually instrumental in recruiting me to Mount Sinai. So he has been really at the core of my research ever since I've been at Mount Sinai. So the focus of our research is working on the mitochondria that are actually the powerhouse of the cell. And the mitochondria are profoundly reprogrammed in cancer cell, and essentially our focus is to try to understand how this reprogramming works.
I've been receiving funding from the Samuel Waxman Foundation for 1 year now, and our focus is studying tumor immunology in pancreas cancer in collaboration with our co-investigator, Nabeel Bardeesy, in Boston.
I've been receiving funding for about 6 or 8 years now as part of a team that is composed of Bob Casero and Steve Balin. My primary area of research is epigenetic therapy in solid tumors and how we can use that therapy to fight tumors and activate the immune system.
I've been receiving funding from the Waxman Foundation for almost 10 years now, and the primary focus of my research are the biology of pancreatic and biliary tract cancers.
I think the research breakthrough I'm most proud of in regard to the research we've performed thus far is to define a role for the microbiome or bacteria in our body in promoting cancer progression, particularly pancreas cancer progression. We've shown that if we target select bacteria, we can enable immunotherapies to actually be effective in pancreas cancer, and we've been able to take this to the clinic in the form of a new exciting clinical trial.
And I would say that one of the aspects that I'm most proud of is that, along with Sam actually, we conducted a phase 2 clinical trial in breast cancer using proteasome inhibitor, which is used in multiple myeloma, which is a blood malignancy. And we used it in combination with a drug that is currently used in breast cancer. And we were able to recruit over 130 patients to this trial. And it showed like very promising efficacy. Now,
the research that I'm most proud of that's been supported by the foundation include the development of mouse models or model systems of biliary tract cancer, and they're used to understand how certain therapeutics cause the cancer cells to mature, to sort of differentiate into normal cells. This is part of a broad theme that the foundation has really been a leader in developing. And it's been gratifying that our work has revealed some therapeutic opportunities in biliary tract cancer along these lines of differentiation in cancer.
What I'm most proud of is that as a basic scientist, my research has actually made it into clinical trial. And I'm very proud of developing an ovarian cancer model in our team that is syngeneic, and it's in a mouse with an intact immune system, where we're actually able to really understand how these epigenetic drugs modulate the immune microenvironment over time and how this might be applicable to women. I'm also very proud, as a breast cancer survivor, of my work in ER-positive breast cancer, and what we're finding as to how epigenetic therapy may be able to degrade and silence the estrogen receptor.
My outlook on curing cancer is that it's really a collaborative endeavor involving teams of cross-disciplinary expertise. The old model of working in silos scientifically is certainly being superseded by this appreciation that multiple disciplines need to be brought in, and teamwork is essential for this.
I guess I'm hoping, I don't really know how I impact, but I hope that my impact is on young women scientists, showing them that they can do this, that they are as good as anyone else, and that it's a tough field, but they have my support, and I'm so proud of my female students and postdocs when they go on to become faculty members or postdocs, and that they're going to be even better than my lab and really push science forward when I'm no longer doing it. You know, the next generation.
The most rewarding aspect of doing research is that every day you wake up and to come to the lab to discover something that nobody has seen before. And I can't imagine doing anything else but research, because this is truly my passion. I love what I do. I believe in what we do, and I really think that despite the difficulty that are intrinsic to this type of work, the satisfaction of when you discover something and you get to publish your result and you get to present and share your scientific finding with others that share that passion, this is priceless, and I love what I do.